Judge strikes down a national order requiring travelers to wear face masks on airplanes and other forms of public transportation. This just happened a short time ago. Here to answer your questions about that and more, Dr. Emily Heil, who is an infectious disease specialist at Mass General Hospital. Good to see you, Doctor. Thanks for being with us.
Hi, Dr. Heil. Thanks for joining us. So the White House has not yet announced if it will appeal today's court ruling, but as you know, just last week, the CDC extended the mandate till May 3rd. So bottom line here is, do you think there is still public health reasons to keep it in place?
I do think that there are public health reasons to keep a mandate in place in public health transportation, mostly around people who are not yet able to be vaccinated. So, for instance, under 5 years old, there's no eligible vaccine for those kids, as well as for people for whom the vaccine is not as effective, people who are immunosuppressed, or for folks who have not yet gotten a vaccine or taken a booster, which is currently recommended for many. So I do think that there are public health reasons. But with that being said, I think masking is very effective with a high quality mask. So for people who are particularly at high risk for severe illness or who are concerned about becoming ill, I do recommend upgrading to a high quality N95 or something similar in terms of being on public transportation if the mask mandate is not to be maintained.
Doctor, can we talk about the COVID data? There's a new national study that's estimating the popularity of at-home tests. We all have at-home tests. Most people do. That's led to a severe undercount in the official number of infections that we tell you about every day, that the true count could possibly be 15 times higher. So does that mean that there's more virus circulating out there than we believe, than we think?
Absolutely. I think that's exactly what it means. So remembering that many people are now testing at home because it's more convenient and also in many ways very accurate for in the moment because you get your test result right before you might be seeing folks who are very vulnerable. And so I do think we're missing a bunch of people who are not that sick, but who are testing at home. I also think that as like it was before, we're missing people who are not very sick at all with very mild symptoms, but might be infectious to others. So overall, I do think that the case counts are underrepresenting the amount of virus. And we're seeing that, for instance, in metrics like the Boston area wastewater.
Right. So let me just pick up on that. Should people, when they do their tests at home, immediately report the results of that? I mean, should they be diligent in doing that? I mean, it shouldn't surprise anyone that people prefer to swab their nose and keep their privacy to themselves, right?
Well, I think that it is more convenient to do these types of tests at home, especially not having to figure out where to go to test or wait on a long line or wait to get your result, which often can be quite delayed. I do think it's really important for people who are at particularly high risk for severe illness. So folks who are older or who are immunosuppressed or who have multiple medical problems to talk with their doctor immediately or another health professional. We do have excellent outpatient medications that are available in the state of Massachusetts for people who are at high risk for severe illness. So it's really important if you're feeling ill to test either at a home test or at another testing site so that you know your result and then you can access these incredibly effective outpatient medications and treatments to prevent progression for severe illness.
Doctor, we have thousands of tourists in Boston to either run or watch the marathon. So are you concerned about the impact that these crowds could possibly have on our case numbers?
I think this past week is going to bring the potential for a rise in cases, not just from the marathon, but also from all of the spring holidays that people may be celebrating with friends and family, as well as school vacations. So I do think there may be the potential for a lot of mixing of people, remembering that outdoors activities are considerably safer in terms of having good ventilation. And if you are gathering indoors, to open windows and doors to try to increase the ventilation when you are gathering. I really want to emphasize the importance of testing, like we just were talking about, especially before seeing particularly vulnerable friends and family for severe infection. So you know your status before you might unintentionally expose somebody.